Due to CBM's intervention and support, the primary ear and hearing care resources have been used around the world. This was done with the World Health Organization. We have trained healthcare workers of various levels in many different countries, and they have been translated into many different languages. So how did I come into the field of deafness? Well, at school, in secondary school, my schoolwork started to go down. Again, I was labelled lazy or stupid. I failed my third year in secondary school, went to teacher training college, and I failed my final year. Well, Sally's definitely lazy. At the age of 27, I was sitting in the staff room with a teacher on either side of me, and they were chatting and then asked me a question. I turned to them and said, "I'm sorry, I don't know what you're saying." They then worked out that I hadn't been able to turn my head fast enough to see what they were talking about. They suggested I have a hearing test, and that was quite traumatic. I found out that I had lost 40 decibels in one ear and 30 decibels in the other. I started wearing bilateral hearing aids. I taught for 17 years in a primary school, but towards the end, I was really tired and stressed. I could no longer hear the children as well. I was faced with this big hole. It felt like looking down a black pit. How was I going to support myself and my daughter? Would I be able to work anywhere again? And that was quite a difficult period to go through. I restudied design and technology and became director of a teacher training college in design and technology in Cape Town. After a couple of years, I moved to Geneva and met Dr. Andrew Smith, and together with CBM support, we developed the primary ear and hearing care resource. And this has been a very positive effect on millions of people's lives.